and I want to go over and back as fluid as I can with the Minister, and I accept it's a difficult format. Minister, I certainly don't want to bash the government over the head on the rollout of the vaccine, and I certainly don't want to bash over the head Colm Henry and Professor McCrath and Professor Butler, who have a very difficult job, and we all wish them well, and we want this to be a success. Everybody in this House wants the rollout of the vaccine to be a success because it is vital in terms of eliminating this virus as best we can. So we are under no illusion that's the case. And also, can I make the point, there is a lot of hunger for information out there from the public, but draw on that as a positive, because it shows that people want to be vaccinated. We were having discussions even before a single dose arrived as to who would or wouldn't get the vaccine. We can now see people do want it. So what people want is information, clarity, certainty and honesty in relation to all of that. You said earlier, Minister, my first question is that 700,000 people would be vaccinated by the end of March. Can I just ask in a very brief response, is that inclusive of the second dose?
Thanks, Deputy. So for most people that includes both doses, but you'll appreciate there's a 3-week gap. So for those who we would be getting to, say, in the last 3 weeks of March, their second dose would spill into weeks 1, 2 and 3 of April. Okay, and then of that 700,000, the most up-to-date information we got from the last briefing that the health spokespersons was given by Professor McCrath and his team and Colm Henry was that we're getting 40,950 doses of the Pfizer vaccine on a weekly basis up until the end of March, and that may increase if the additional procurement with the European Union comes on stream. Has that changed? So when you say 700,000 people vaccinated by the end of March, is that based on that current flow of vaccines coming from Pfizer in terms of the 41,000, or are you building into that the AstraZeneca vaccine that might be certified as well at the end of January? Thanks, Deputy. So yes, we're assuming, and remember, these may not all come to pass, but what we're assuming to try and give people some sense of what might be possible is that AstraZeneca is authorised on the 29th, that we very quickly begin to get amounts of that. We are planning on several 100,000 doses within Q1. We're also planning, which again may not come to pass, but we are planning on the Pfizer amounts increasing, not by vast amounts, but increasing in terms of the weekly amounts, including, as you quite rightly say, the additional opt-in as well.
Okay, so what you're saying then is that 700,000 is a best case scenario based on building in the AstraZeneca and on the current number of doses that we're getting from Pfizer. So my next question is that on the day that we were being briefed by Professor McCrath, the news came through that there was €300 million more doses now procured through the European Commission, and that we're in for 3 million doses of that. When is that likely to arrive? So in other words, where are we then in terms of the priority, because the US is in for more, Germany, as we know, have ordered more. Are they going to be ahead of us? So when is that 40,950 doses a week that we're currently being told are arriving from Pfizer, when is that likely to increase? Is there any time frame at all being given to you in relation to that?
Thanks, Deputy. So yes, so the 300 million, the EU has confirmed the first 200 million. Cabinet agreed yesterday that we would buy into that, so we get 1.1% of that. This is the third tranche, if you like. So there was the original Pfizer amount on the APA. We got an additional amount through an opt-in, and then what was agreed yesterday is a third amount. The schedule we have is that would begin coming in Q2, and I'll get you and colleagues the Q2 and Q3 amounts and how that breaks down.
Okay, I accept that. And can I ask a question as well? And again, I ask this constructively, and I'm not sure if it's possible. If AstraZeneca, as we anticipate, will get certification at the end of January, and we know it's one of the companies that have done a huge amount of advanced manufacturing, is it actually possible that we can get shipment of that vaccine into the state before certification, so that when it's certified, it's actually here? Have you asked the European Commission, is that possible?
I've asked my department to look into exactly that, and the Chief Medical Officer and I have had that conversation this week. It's exactly what I want to see. So we saw the UK did it. It happened in Northern Ireland. It was in the GP surgeries. The moment it was authorised, they were able to start. Now, the reality is, because it's in the UK, it's manufactured in the UK, we can get it here very, very quickly. So the additional time we get, I don't believe would be very much, but I fully agree. If we can save a day here, a day there, we should do that. And so I've asked the department to engage both with the Commission and critically with the pharmaceutical company itself to say, can we ship in ahead of time?
And my final question, because my colleague will want to come in, I want to have one final question on the vaccine, and then I want to put a question to you about what's happening in our acute hospitals at the moment as well, Minister. We are getting a lot of queries, all of us, in relation to different cohorts of the population who are asking genuine questions as to where they'll be in terms of the rollout of the vaccine. Carers and home helps are two of the categories that we're getting a lot of calls from. So where are they exactly in terms of the different categorisations? You said you're going to publish as well that priority list of frontline healthcare workers that hospital managers are working from. I asked for that last week. I still haven't got it. But I think it's important that's published. But where are carers and those who provide home helps? When are they likely to see the vaccine? And on the acute hospitals, Minister, I said to you earlier that I'm dealing with all of the different representative groups. I've met many of them, and I can tell you that they are very, very worried about what they're already dealing with and what they anticipate that they will be dealing with next week and the week after with rising numbers and hospitalisations. They're very sore about the fact that the investments in ICU weren't made to their satisfaction or in hospital capacity. There wasn't any rapid modular build to any great degree, and we called for this in the summer. There's issues, as you know, with public health specialists who called off a strike action, by the way, and are sore that that wasn't recognised by you as Minister in a positive way. Hospital consultants have pay equality issues. Student nurses and midwives have legitimate claims in relation to their pay. And they see this, all of those issues, and the failure to deal with the Minister as a failure to value the work that they do. So can you engage with those representative groups on those issues? Because the anger that is there at the moment from those on the front line, that they are dealing with a dire situation, and that seething anger that those issues are not being dealt with is really genuine and palpable. And I would ask you to address those issues, Minister, in the short time you have, if you can address those.
Just, Minister, you have barely 15 seconds. I'm sorry now. It's just the way it's worked out.
Will I write to you? Yep. Thank you.